Hello everyone, welcome to Clearview Eye Care's very first video blog. I'm Dr. Beach. Thank you to all of our Facebook friends out there that have been leaving a lot of comments and questions regarding some of the topics that we've been trying to get out there on how to keep your eyes healthy and how to keep your vision at its best. And I really can't think of a more important topic for us to be discussing in our first video post than diabetes. November is the American Awareness Month for Diabetes, sponsored by the American Diabetes Association. It's really an opportunity for healthcare providers and patients in general to have some very open conversations regarding the seriousness of the condition, regarding the complications of the condition, and then also the risk factors for developing those complications. I can't say enough about how serious diabetes is in our country, and perhaps it's a little bit underappreciated, but one statistic that I came across on the American Diabetes Association's website might be a little bit surprising to most of us, and that's more Americans will die every year from complications related to diabetes than they will from breast cancer and AIDS combined. So it's a very serious condition in our country. In general, diabetes can have an effect on different parts of the body. The eyes are definitely no exception. One of the biggest complications that we're concerned about is diabetic retinopathy. In general, diabetes can cause our blood vessels to become leaky, and then when we see this on the retina, which is the tissue in the back part of the eye which absorbs all our vision and light, we can see blood accumulate on the retina, we can see swelling, fluid leakage there too. Depending on the location and the severity of that leakage, we can develop some permanent vision loss or blindness. Another surprising, scary statistic is that diabetic retinopathy is the leading cause of blindness in Americans over the age of 50. In fact, more Americans over the age of 50 will go blind from diabetic retinopathy than they will from glaucoma or macular degeneration. Again, so a very surprising and scary statistic. There are a few things that we can do in order to take care of patients with diabetes and hopefully prevent long-term vision loss. Retinal surgeons have a few different options available to them. We have some laser surgical treatments, which also can help seal up some of the blood vessels in the eyes, reduce some of the swelling and fluid accumulation in there, and hopefully prevent long-term vision loss down the road. There's also some injectable medications which can help prevent vision loss down the road. But probably the most important thing that we can do is regular routine preventative eye exams. Diabetics should have their eyes dilated every 12 months, so that way the optometrist or the ophthalmologist can take a look at the inside of the retina and we can pick up early signs of the condition, perhaps before even the individual notices any of these symptoms. That will allow us to take a look at the blood sugar and then see if we are at the best in terms of control on that blood sugar, but also allows us to monitor those changes over time. So that way, if we see continual progression of the condition, we can get that patient to the retinal surgeon in a timely manner. Those surgical treatments can be performed and hopefully prevent vision loss down the road there as well. So again, November is a golden opportunity for us as optometrists and patients, but also as friends and family members to have some conversations with diabetics around us in terms of spreading the word on the seriousness of diabetes in general, but also the ocular complications and the risk for blindness, and then the importance of dilated annual eye exams for diabetics. So that pretty much concludes our very first video blog post, a very important topic. Hope that you found this useful, and we look forward to seeing you again next time.